Hello Ryan, my name's Dan.
How you doing, Dan?
Good. I'm going to be your PT today. We're going to run the Astrand test.
Okay.
You can go ahead and start pedaling right now. So we went over some of your information, and it all looks good. So we've gone over some of your ACSM risk stratifications, your BMI, your medications, your family history. You're a non-smoker, and based off some of that information, you come out at a very low risk for cardiovascular disease. So we clear you to perform this Astrand test, which is a way to measure your submax VO2, which can then be used to calculate your max VO2. So we can safely prescribe exercise to you if need to. Okay, so right now I'm just having you warm up for 2 to 3 minutes at a workload at 25 watts. I would usually have you go at 0 watts, but this machine doesn't go that low. So also you're going to keep your RPMs at 50,
Okay.
50 revolutions per minute. Keep it going throughout this whole test. And again, I adjusted your seat to your greater trochanter height to fit your comfort level. Is everything comfortable?
Yeah, pretty good.
Perfect. Okay, so at any moment during the test, if you feel uncomfortable, if you feel like you can't breathe, if you just feel like you can't go on with the test, just let me know. We could stop the test. Also, I've calculated your submax heart rate zone, and if you exceed 85% of that, which is 157 beats per minute, I'm going to stop the test.
Okay.
I'm also going to measure your vitals during this, so if I see anything wrong, we'll stop the test right away, okay?
Good.
All right, so again, using an ACSM formula, we've calculated that because you're an active male, 32 years of age, you're pretty active, so we're going to start you off at 150 watts, okay? So I'm going to go ahead and bump that up. Again, keep this at 50 RPMs, okay? So I'm bumping it up. Should be pretty difficult here. Okay, and I'm going to monitor your heart rate at the second minute into this increased workload, so that I can see if this is a good workload to put you in your submax zone. Okay? Yeah, just keep that right there. It's 50 watts or 50 RPMs. Stay right there. Again, let me know how's your comfort level.
Fine, yeah. That feels good.
This is a way of measuring your intensity based off your perceived exertion. What number would you say you're at right now?
7.
7. Okay, great.
Very well conditioned.
Yes, you are. We've determined that through a risk stratification and background. So.
Well,
Okay.
this is day after Thanksgiving.
It is. So that it is. We're gonna try to burn some calories.
I feel a little heavy.
Okay, so in about 30 seconds, I'm gonna check your heart rate.
Okay.
Okay. And I'm gonna need a blood pressure reading, just to see that you're responding normally to exercise. Also, I'm gonna get an oxygen saturation test, just to see where your levels are at. Okay. All right, Ryan, I'm gonna check your heart rate. Okay. Blood pressure. Thank you. Great, Ryan. Okay, what would you say your RPE is at?
About 13.
13, okay. Perfect. Now you take a finger here. Thanks, Ryan.
Good.
Okay. All right, Ryan. Your heart rate is responding normally. You fall within that submax zone. I've got you at 144 beats per minute. So we're going to keep this test rolling. At the 5th and 6th minute of this increased workload, I'm going to recheck your vitals again just to see if you fall within your steady state. Okay. So if I notice that your heart rate's within 5 beats per minute on consecutive tests, we're going to shut this down. I'll have you do a cool down. Okay. And be all set to go. How you feeling? You
Good.
okay?
Yeah, I'm working hard, but it's good.
Yeah. Okay. Any symptoms? No? You're doing okay? Great. Although you consumed a lot of turkey and food yesterday, you know, your BMI is looking pretty good. You're at the lower end of the healthy range.
It's because I'm well conditioned.
I would agree.
I give myself the Astrand at least 4 days a week.
Okay. I'm going to go ahead and check your heart rate again.
Okay.
Thanks, Ryan. Great. And your blood pressure reading. It's looking good. Ryan, what's your RPE?
I'd say probably about 14.
14? Okay, it's normal. Still working hard, I see. 14 RPE. And, okay. 88% on the oxygen sat. It's on the lower end, but just check you one more time, okay? 14 RPE, all right. One last heart rate, Ryan. Looks good, Ryan. You're falling 2 consecutive in your steady state. Okay, so I'm going to shut you down after this heart rate reading, or after this blood pressure. Just rest it up there. Great. All right, Ryan, what's your RPE?
14 or 15.
14, okay. All right, Ryan. I'm going to drop you down. Just keep it at 50 RPMs, okay? Just back down. We're going to run this for about 2 to 3 minutes. And I'm going to recheck your vitals just to make sure that you're responding good to this exercise, okay? 96, everything normalized. Okay. Any other questions?
No.
All right.
Thanks, bud.
Thanks, Ryan. That's the Astrand.